Our ultimate goal, it's a little scary to say it, but we're trying to cure cancer. We wanted to set up a whole program here to be able to treat patients with designs and strategies that we discovered in the laboratory.
Taking our science from the bench to the bedside requires a tremendous amount of resources and support, collaborative efforts among brilliant minds. I truly feel like you have to be in this system to really change the way we practice medicine.
I think it's one of the amazing things about our research teams here. They are driven by science for sure, but they are equally driven by the patient.
The clinicians and scientists here try to develop the best therapeutics, and just being around these brilliant minds is really intellectually stimulating.
The system allows us to create multidisciplinary clinical teams. They give us the structure, the framework, they encourage us to do that in a really easy way.
There are very few places like Mass General Brigham where you have such a large, complex, comprehensive healthcare system that can really deal with any and all kind of disease. Very few places can do that.
My work really revolves around figuring out ways to use the immune system to treat cancer.
One thing that's really exciting about cellular therapies is that it's using your own body. It's doing something nature has been trying to do, but just doing it better.
What we have done is we've taken the ability to control the cancer growth so that if the cancer reoccurs, then you have a good immune system to fight that cancer.
In the lab, we're actually training AI-driven algorithms to learn off of hundreds of thousands of real patients' journeys. And so the patients are what are teaching our algorithms.
That's one of the most exciting pieces that AI brings to the table. Now we can really personalize it to predicting how you're going to respond to each of these treatments and fit that in with a patient's priorities. That's a new level of personalized care.
Because we're interested in taking care of the patients today, but we're also interested in educating the next group of scientists and clinicians who share the same passion that we do. I feel so grateful to be in this intellectual environment. Everybody around me is motivated. We have trainees, and these are incredibly bright young minds who come with fresh new ideas of how they're going to study the immune system.
To see that these could potentially have an impact on patients' quality of life, that would be extremely gratifying.
We definitely hope to see this research go beyond cancer.
We can treat even more patients with these effective and exciting treatments. We may not be able to say we have cured all cancer, but we can very confidently say that we are curing some cancers.